Neuropathic pain. Now, not all pain feels the same, and not all pain comes from the same source. So whilst arthritic pain often stems from changes in the joints, neuropathic pain originates in the nervous system itself. It's caused by nerve irritation or damage, and it can feel very different from the dull ache of arthritis. People often describe neuropathic pain as burning, shooting, stabbing, tingling, or even feeling like pins and needles or ants crawling. It can become constant, or it can even come in bursts, but it often follows the path of the affected nerve. And so even light pressure or mild touch can feel sometimes really, really intense. Now, with neuropathic pain, there can be many triggers, and that includes sciatica. It's a common one. It's where there's compression or irritation of the sciatic nerve in the lower back, which sends down pain down the leg. You can also have nerve entrapments like carpal tunnel syndrome in the wrists. You have disc injuries, like herniated or bulging discs pressing the nerve roots. You could even have peripheral neuropathic pain from diabetes. Now, you could even have it from surgeries that you've had in the past where the nerve pathways have been affected. But the most important thing to know that neuropathic pain is not in your head, it's real, and it's a physiological response. The nerve is sending amplified or altered signals to the brain, and the brain interprets those signals as pain. So neuropathic pain can then be mistaken as joint or muscle pain, but there are some key differences because pain may follow a clear nerve pathways. So the sensations can include numbness or tingling, and the symptoms might be worse at night or when in certain positions. There also might even be muscle weakness that might accompany the nerve pain if the nerve is reduced. And it's important though, but if you take thorough history and you look at the big picture, do an examination, and when needed, do imaging, it really helps determine if the pain is nerve related and where the problem originates from. So chiropractic care may help with neuropathic pain, and the goal is really to reduce irritation on the affected nerve and improve the environment that it functions in. And how does chiropractic care do this? It does this by restoring spinal and joint alignment to relieve nerve pressure, by improving mobility to allow better circulation and healing in the area, reducing inflammation that might be contributing to the nerve irritation, which then supports optimal nervous system communication so that the path signals can normalize over time. Now, when the spine and joints are moving well, the nerves have a better chance to calm down and then function normally, which then often reduces the intensity and the frequency of these pain episodes. In addition to chiropractic care though, for nerve pain, you also want to be making sure you implement some lifestyle strategies such as gentle stretching, nerve gliding exercises that are prescribed to you, also taking anti-inflammatory supplements, eating an anti-inflammatory diet, and also having regular movement to promote healthy blood flow to your nerve tissues. So the takeaway is, neuropathic pain can be very frustrating and very unpredictable, but it isn't something you have to live with. So by addressing both the physical mechanics and the nervous system health, there's often a way forward toward relief and better function. If you suspect your pain may be nerve related, or you've been struggling with symptoms that just haven't improved, let's explore what's going on together. You can call us on 6299-2660 to book an appointment at Provolution Health. Thank you.